Hi, and welcome to Facebook Live. Tonight's Facebook Live is all about cup size after a breast reduction. I'm Richard Bloom from Plastic Surgery. Welcome everyone. Thanks for joining us. As always, there will be plenty of time for Q&As, and I'll be giving a sneak peek into what is coming up next month. Let me just have a look who is on. Oh, we don't have any comments, hellos from anyone. All right, well, there are a few people on. For some reason, we got scheduled at 7, not our usual time slot, but that's okay. Try something different. Maybe it'll suit some people better. Maybe got a bit of a new audience, people who don't, 7:30 doesn't really suit. So let's get into it. This video is all about your cup size after a breast reduction. So first things first, how is it calculated? And I'm just going to cut to here. Okay, so it's a very vague measurement. From this Facebook Live, you can't go away thinking that this is an exact science. There's no sort of golden breast cup sitting in a museum that is the empirical size for a breast cup. So the way it's worked out is, and you can see from this image, is you take a measurement around your chest, just below the breast. Then you take a measurement around the widest part of your breast, and you subtract the chest breast measurement from the chest measurement, and that difference is your cup size. Now, if you go in inches, if there's 1 inch difference, then that's 1 cup, 2 inches, 2 cups, and so on and so forth. Now, this is where it all starts getting vague, because whilst that's okay in theory, and the number is generally estimated at about 150 cc's or mils, but as the cup size gets bigger, then that volume between them also gets bigger. So C to D is a bigger jump than A to B. So as the cup size gets bigger, the actual volume between them also gets bigger. Also adding into the confusion is that as your chest diameter gets bigger, the cup size also relatively gets bigger. So a 14C is bigger than a 10C. And that's just the start of the confusion, because then you've got to add in the different bra types. So a strapless bra is going to fit very, very differently to a sports bra compared to an underwide bra. And that's even before we get started with the bra manufacturers, because they also had their own measurements and their own styles. And even within one manufacturer, you may have different styles which also measure different. So one thing I will say is most women coming for a breast reduction, and this is uniform across most of the patients, is that they have troubles finding bras, and more than that, they very rarely can find a bra that fits them, because often their breast doesn't match with their chest diameter. So take the example of a young girl who is maybe a 12 chest diameter and she's a F cup. Well, she's not going to be able to find a 12F breast cup bra because, well, that just doesn't exist. So she ends up being in a 14E cup or 14D or something like that, which often means that the cup isn't particularly full. It's often empty and may need padding to even fill it out. So it's a very common thing I hear from patients who come to see me, is that even though they've got very big breasts, they don't fill out the bras necessarily. And the reason for that is they've got a lot of extra skin. So to cover over all of the extra skin, you need to have quite a big cup size. So you often end up in a bigger cup size than, say, your volume is, merely so that there's enough material to cover over the nipple. So sadly, there's not a hard and fast measure of what a cup size is. There's sort of scientific ways that people can do it, but they're kind of weird and not really practical. So you could lean over, it's called a water displacement test. You could lean forward into a bucket of water and see how much water disappears, and that'd give you an accurate volume. But that's going to be pretty messy and probably not going to want it. It's a bit weird. You're not going to want to do that in a consultation. And also, it probably doesn't help me much when I'm doing surgery. The other thing is the Vectra, which is a 3D simulator which we use for breast implants. That doesn't work in the same way for a reduction. So you can't get an estimate from that. So unfortunately, cup size is probably the least useful way to discuss breast size. That said, we all do go to that, because it is a general concept that people will understand. But I'd prefer to talk about what I consider the holy grail of breast reduction surgery in terms of outcome. So what we're trying to achieve is good projection. Now, it sounds a contradiction to say we're doing a reduction, but we're getting increased projection. So what projection is how far your nipple sits out from your chest. So in doing a breast reduction, you can actually get better projection, and you'll see it in some cases that I'm going to go through, even though I'm removing breast tissue. And you can even do that in a patient that's more like a lift than a reduction. The other thing is fullness. So the tissue that I'm leaving is in a smaller skin envelope. So it feels tighter and it feels firmer. We just refer to that as fullness. So again, I'm removing breast tissue, but I'm increasing your fullness. The other thing is you want a nice cleavage. So you'll see in some of these patients, the common cleavage in a patient coming for breast reduction, it's like a triangle. So the slopes, the inner border of the breast is a vertical line, pretty much. And what we want to create is a nice curve. So again, that's what we're trying to achieve. And what every breast reduction patient wants is to have no breast tissue sitting on the chest. So therein lies a dilemma as well. So let's say we do a calculation and we allow maybe 150 grams per cup, and you're starting off at a double D and you want to go to a C, so 450 roughly. Well, what happens if I do that, but then I still feel that there's more breast tissue that's going to be hanging on your chest, which you don't want, but to remove that, I'm then removing another 100, which maybe makes your C cup. So at the end of the day, it's a guide, but it's not the be all and end all. What is more important is that we get a nice shape, and the cup size will take care of itself. And at the end of the day, regardless of cup size, if you feel it's too big or too small after, then there might be other measures that we need to consider. So what are the main components of a breast reduction? So number one is lifting the nipple. Where should the nipple be? There's a whole lot of different ways of measuring that. Traditionally, we used to put it at the fold. That's obviously ridiculous. It's way too low. There are other techniques where you measure it from a fixed point, say here at the top of the sternum. But what I prefer to do is look at it where the nipple should sit relative to where your fold is. And it should be sitting about 3 or 4 centimeters above that. I like that method because it's easy to do in very large breasts, but also the fold is a fixed point. Some people measure from the top of the breast, but that's kind of a bit vague. And at the end of the day, if you've got a low fold, you still want that nipple sitting relative to the fold. The second thing is to reshape the breast. And the way that we do that is firstly the internal bra suture. So I run that where an underwire would be sitting. Sorry, I just had a phone ringing. Nothing. So I run that where the underwire would be sitting, and that fixes that fold in place so that you get a nice stable base. The second thing with reshaping is bringing the two pillars together. And the best way to consider this is think of a pizza. You take one piece out and you bring the two ends together, okay? Now, what's that going to do with the pizza? It's going to make it sit up more or project more. So that helps again with the shape. And then the last thing is remove the overhang. So remove all the tissue that is hanging over the fold. And that's about it. Okay, so if I'm saying cup size isn't a great test, and I'm saying I can't use a Vectra, that doesn't work, how can you measure it? Probably the best guide, and it's just a guide, is what I would call the pen test. So you get a pen, doesn't have to be an Apple pen, it could be any pen. Get the pen, put it where, I'll show you in some photos, put it right up under the breast where your underwire would sit, okay? Imagine that going through to the front of the breast, and everything that is above that we're keeping, plus sort of the nipple and the tissue that's attached to. So a little bit more than that, but basically that is what's staying. Everything below that, that's what we're removing. And that should make intuitive sense when you put together with what I was talking about. We want no breast tissue hanging below the fold. So simple pen test, I often show that to a patient in their drawings. I'll show you in a sec, but that's basically what we're keeping. So you've got your consult coming up, coming to see me, and you don't know what to tell me. Let me make it simple. Firstly, bring some photos of breast sizes that you like. Okay, I will go through photos as well, but if you've got a photo, and you've got to be a bit careful because, if it's in a bra, it's not exactly, you don't exactly know what you're dealing with. But if you've got a breast, basically size that you like, bring that in. That might help. I will show you before and after photos. I'll show you patients who have done a breast reduction and the result is quite a small result. I'll show where it's still quite full, and I'll get a gauge of what you're trying to achieve. Then in terms of so you can just say, listen, I just want to be proportionate. All those things I said before, nipple raised, no overhang, and it is what it is. The second thing you could say is, look, I want to keep as much tissue as possible. I want as much fullness as you can keep, in which case I'll remove what I said, but not remove any other tissue sort of where there's areas where I can safely remove tissue. So that's a reasonable set. Keep as much fullness as I can. Certainly in some of those patients in the upper pole, because in a breast reduction you don't add anything to the upper pole. I will occasionally do a fat graft to the upper pole in patients who want to try and maintain as much fullness as possible, and they don't want to have an implant, but it's got to be a small volume. The third thing you can tell me is you want to be as small as possible. When you want to be as small as possible, I can remove a little bit more tissue from the side. I can sometimes do a bit of liposuction. I can thin the pedicle, which is the tissue carrying the nipple. I can thin that out as much as possible, and try and make you as small as possible. But if you're very, very big and you want to be very, very small, then you're maybe looking at a slightly different technique, which is a free nipple graft, and I'll have that discussion with you in your consultation. So hopefully that makes sense. If you do have any questions, do pop them down in the comments, because I will get to all of that and go through it. So now I've got some cases I want to share with you. Here we go. Alrighty. So this is a 20-year-old patient. Now she's got some asymmetry. You can see her right breast is slightly bigger than her left breast, and I removed 990 grams from the right and 615 grams from the left. So she's ended up quite symmetrical. I'll show you the pen test on the side-on view, but what I'll show here is this cleavage line, okay? So that's a classic cleavage line of someone presenting for a breast reduction, and you can see here we've ended up with a nice symmetric curved cleavage line, and you can see you can imagine that internal bra sitting sitting along that line. But we've brought in, you can see how much side boob there is there, and certainly brought that in from there. And you can see this mole here, which you couldn't see previously, because we've now lifted all of that breast tissue up off the chest wall. And the effect that has is of lengthening the torso, which I talk about a lot, but you can see just how much longer she is through here, which gives much better proportions compared with what that was before. And these photos are in pretty good symmetry, where her waist was quite short and her torso was very long. And by showing more of her side chest and also showing lengthening that distance, she looks way slimmer than her previous photo. Okay, so what's the pen test? So the pen test is you would, same patient obviously, side on, you'd put a pen under there. So basically there, and everything above the line we're keeping, everything below the line other than the nipple effectively, that's what's going. Now you kind of got to envisage that all being pushed together, but when you look down at your cleavage, that's kind of what you're going to see. Alrighty, so this is just starting off from side on. again, you can see here, there's all of that breast tissue hanging below the chest, and then we've got everything above the chest. So this patient had about 550 grams removed from each side, and you can see here again that, cleavage lines here going straight, and then we've got nice curved cleavage lines there. Let me just go back. This is what I'm talking about as the projection. And you can see sort of where that nipple was sitting, which was almost level with her tummy. And then you can see it here, and it's sitting out further. So I've added projection in there. Again, we've corrected this side boob. But again, if you have a look at the tissue above her fold, that's the breast tissue that we've kept. All right, this patient, 31-year-old patient, again, a little bit of asymmetry. So her left breast is slightly bigger. So I removed 550 grams on that side and 490 on the right side. You can see we've ended up pretty symmetric, all the same features. So we've gone from that cleavage to a nice rounded cleavage. There's no breast tissue sitting below there. That's all gone. The breast that's hanging out from the side of her chest, that's been narrowed. And we've can't see her belly button here, but her belly button is, let me change colour there. Her belly button, her proportions are way better than what they were. You can see a belly button there. So that compared to that. So that's exactly what we're aiming for. Now, what cup size is that? So I don't have the cup sizes recorded, what she was before and what she was after. But in theory, I've maybe reduced her 3 cup sizes. But I don't know. Her pre-op, I would estimate is at least a double E, and I think post-op she's probably a C or maybe a D. So I'm not sure that quite correlates. Again, all these same features. No breast tissue below there. That's the tissue above there is what we're keeping, and she's got this nice projection, and I'll change colours there. A nice lower pole curve and a nice slope through there. Alrighty, we're moving through them. I'm not sure what number that was. Now, this patient is a 22-year-old. Now, this is an interesting case. She didn't have a huge amount. She had some asymmetry. You can see her left breast is bigger than her right breast. So I've removed 345 grams from that side, 220 from the right. So they've ended up quite even. It's interesting here. You can see that mole. There's a mole here. So if you have a look at that line there, and then that's that line there. And you can have a look how much I've lifted her nipple. But, same sort of things. Nice curve. I've kind of centered the breasts a little bit. They were sort of sloping out that way. But as the nipple sort of moves up along that line, the breasts naturally are going to come together. And then you have a look from the side. Not as much to see there, but you can get the sense that sort of what we've kept above that, above the inframammary fold is basically the breast volume that she has been able to keep. But again, look at these moles on her arm. Her arms are in similar positions. That's that top one. You can see just how much that nipple has been lifted to get the right shape. So it's possible in a patient like her that her cup size, and let me just demonstrate this, it's quite possible in her that her cup size has maybe not even changed, even though she's had a reduction. And the reason for that is she was probably in probably would have changed. But this is what I was talking about in terms of wearing a cup size that is way too big. So she was probably in a cup that was way too big for her because it needed that amount of material to cover over her nipple. So it's got to go all the way down and then all the way up. And what I've done is I've shortened that curve. So if you take this line to this line and compare it to this line, that's all of a sudden much smaller. So what I was trying to say with her is, like, let's say I've reduced her by 300 grams roughly, which is maybe 2 cup sizes. She may have actually gone down more than 2 cup sizes because she was wearing a cup that was much too big just in order to cover the nipple and all of her breast. So, when you add that into the mix as well, it's an ill-fitting bra, which is maybe a double D or an E. How then could you possibly calculate what cup size it'd be after? But I don't know. My best guess is that's maybe I'd say that's a full B. But I think in terms of volume, pre-op, she was probably like a similar sort of volume. Okay, so this is another interesting case. This is a 32-year-old lady. So she actually had breast implants in, which were big. They were 425 cc implants. So in theory, that is going to be maybe 2 cup sizes. And then on top of that, I've removed 310 grams from the right and 370 from the left. But have a look at the improved shape. You've got the cleavage lines here, which are now nice and curved. We don't have this side boob. We've brought that in much to a better shape. And there's no breast tissue hanging below the fold, and I've lengthened her waist. All right, so I can't tell you how much of a decrease in cup size she had, but it's significant. And you have a look here, and this is what I was talking about. So if you're wearing a bra, you need that to go all the way up there. So you need material starting there and going all the way there. Whereas after reducing the skin, you could have a cup that is just measuring from there to there. And even though I've removed, if you take the implant and the breast tissue, it's something like 700 grams, have a look at her projection. It's not significantly reduced because I've got a better shape and there's better fullness and all the rest of it. All right, so this is my last case. And this is more of a lift, but just emphasizes the point that I'm making, that even with a lift, even with removing breast tissue, you can still get better fullness, projection, and cleavage. So if you have a look at this pre-op, really just looks like empty skin. There's no shape to them whatsoever. You can see where her underwire is. It's somewhere there. And then she's got a nice cleavage through here. Now, just looking at that from front on, which is not sort of the best way probably to assess it, but you get the sense that her breasts now look fuller, even though I have removed about 100 grams from each side. But she's also much shorter through there compared to there. And I think that's a major part of a breast reduction. And if you have a look from the side there, she has not had fat graft. She has not had an implant. This is all just using her own tissue, and I've removed tissue. Yet have a look at that. Have a look at how much better that projection is. Again, she was probably in a bra that was way too big and was empty for her, but she can now find it much easier to find a bra that doesn't need as much material, so the bra can be fuller. So hopefully that makes some sense. All right, so that is all you need to know about cup size after a breast reduction. If you are interested in consultation with me about this or any other surgery that I do, please reach out and make a time to come and see me. Okay, we are now up to the Q&A part, which is always a lot of fun. So let me scroll down. I'll go to the Q&A. We'll start the 5-minute timer. Rowena's here. Hi, Rowena. We caught up today. Chrissy's question. My friend has some rippling. That's generally something that we would see. Generally something we would see with breast implants, not so much with a reduction. So I don't know, maybe that she's had an implant rather than a reduction. I'm not sure. Gab Caldwell, superstar, good to have you aboard. Mandy, what's the process of fixing dog ears, and how long? Generally, Mandy, I generally give it about 6 months. Let everything settle. Some of those dog ears do settle. I know initially they don't seem like they will, but they can. And if we can avoid doing surgery, then that's obviously better. But if you do need it, it's generally a very simple procedure that I would do here in the rooms under local anaesthetic, and that should fix it. But I'd generally say 6 months. Joanna, yes. Joanna, it was meant to start at 7:30. You're absolutely right, except someone scheduled it for 7 and I did post it and I got, I think, 3 votes to start at 7, but we'll see how we go and see whether maybe for those of you watching, or if other people watch it, let me know if I've really upset you by starting at 7 instead of 7:30, or if maybe 7 o'clock's a better time and that suits you, and then we can start doing them at 7. Doesn't make much difference. Doesn't make much difference to me. Rowena wanted to know, is the nipple still the same size, or do you trim it to suit? So we're not allowed to show nipples and areola on Facebook or YouTube. You can see them on our website, and we've just updated our photo gallery. So go to our website, check that out. And I'm going to assume you're talking about the areola, which is the pigmented skin around the nipple. Generally, we wouldn't touch the nipple. So yes, we do make that smaller. That's 100% part of a breast reduction. We mark them out. There's a set cookie cutter. It's actually a cookie cutter, not a real one, but exactly the same as what you would imagine to be a cookie cutter. I measure it to 38 millimeters. You can also get one that's 42. I generally feel they stretch out a little bit, so I like them to start off a bit smaller. And I think more women want smaller areolas than larger. We generally do decrease the areola, but not the nipple. Juliet, how long after I finish breastfeeding can I get a great question. So firstly, get a reduction and a lift. Reduction, there's always a lift with a reduction, and there's pretty much always a reduction with a lift. So they're both the same operation, firstly. Secondly, what's the time? What I would say is your breasts need to return. There's no set time. So once your breasts have returned back to their pre-pregnancy size, pretty much you're good to go. Don't want to be doing it if your breast is still engorged and large, because it's hard to predict the final size and shape. So that's the limiting factor. generally, if you're sort of getting towards the end of breastfeeding, might be a good time. If you're very keen, it might be a good time to come and see me for a consultation. But otherwise, once they've returned back to normal size, then you're ready to go. Meg, hi. Good to have you on board. Joanna, I'm about to have my reduction in March with me. Yay. And I would love to have smaller boobs, but not too small if my tummy would look bigger. I do know what you mean. It shouldn't make your tummy look bigger because of what I was talking about, the projection. So that's sort of the relative thing. That's why a tummy tuck and a breast reduction often go, or breast surgery often go very well together, because you're flattening the tummy and making the breasts sort of have better projection. But obviously it's not physically changing. I understand you're talking about relatively. I don't think it will. And as I showed you in some of those other photos, by taking breast tissue off the abdomen, or the upper abdomen or lower chest, that makes your torso, that makes your tummy look longer, which generally makes people look slimmer. But it depends sort of, exactly on the shape of your tummy. Ducky, can I breastfeed if I have a reduction? We've actually, I think we've just done a podcast on that actually. We've certainly, well, I don't want to ruin the surprise, but we've got something coming up I'll discuss in a sec. So it varies. It varies. I generally tell people about 50% will be able to breastfeed. You got to remember, not everyone can breastfeed, even if you haven't had surgery. So probably about 60% of women can breastfeed who haven't had surgery, and it's probably about 50%. Often women with very large breasts struggle to breastfeed anyway because the breast is too big and the baby can't latch on. So if you can breastfeed, it's perfectly fine. There's no harm to it, but obviously we're removing breast tissue, it's likely that it'll reduce your ability to be able to breastfeed, but not necessarily totally. Mandy, sounds like I answered your question, and Joanna's happy, and the time is up. Alrighty, so I think I did stuff up because a lot of people seem to have joined. A lot of people seem to have joined since 7:30. So for those of you who have joined at 7:30, apologies. We accidentally scheduled this for 7 instead of 7:30. Thought we'd give it a go, see if it suited people. Pop a comment below if you prefer to stay at 7:30. I've got a feeling it maybe does suit more people. If you do want to catch up on what I've gone through, then in the next day or so we'll pop it up on YouTube. Usually slightly edited version, cut down, so usually gets down about 20 minutes or so. Or you can usually find it on Facebook, but it seems to be a lot harder. So anyway, we have a busy month. We've got a great vodcast about imaging, sort of following on a little bit from what I've been talking about today. Oh, I need a drink. But 3D imaging in the Vectra that we use in breast augmentation. I've got another live, in 2 weeks, talking about implants and as you age. Oh, and then we've got the, my apologies. We've got the vodcast about nipple sensation. We cover a bit about breastfeeding there as well. And then Kim's Facebook Live is all about recovery from all sorts of surgery. All right, so we've reached the end of the show. I'll be back in 2 weeks' time with much, much more. Remember, if there's something you would like me to cover, please drop it in the comments below. Thanks for watching. I'll see you next time.